Hi, everyone, and welcome to our first episode of Top of Mind, a program focusing on the neuroscience services provided by Baptist Health Brain and Spine Care, which includes Baptist Health Miami Neuroscience Institute and Marcus Neuroscience Institute. I'm your host, Ryan Lieber. On today's program, we are going to be focusing on brain health and different types of issues that the brain can suffer from. June is Alzheimer's Awareness Month as well as Brain Awareness Month, and more than 6 million Americans are suffering from this disease. 73% of those people are over the age of 75. And by 2050, the number of people with Alzheimer's disease will be nearly 13 million. The numbers are alarming. So what can we do? Well, today we have a wonderful guest on our program to discuss the stats, the symptoms, and the risks, and most importantly, what can be done to help yourself or a loved one from Alzheimer's disease. Joining me today is Dr. Raphael Wald, a neuropsychologist on staff at Marcus Neuroscience Institute. Dr. Wald, thank you so much for joining us today.
Thanks, Ryan. Good to see you.
So let's start with these numbers firstly. These are daunting. By 2050, we're seeing nearly 15 million people with Alzheimer's disease. Why are we seeing the numbers going up?
Well, our population is aging. As we have more treatments for other conditions, people are living longer, and as people are healthier into older age, we're having more of an opportunity for people to develop dementia because they're healthy enough for long enough in order to develop it.
Is there a pattern of what types of people are getting Alzheimer's compared to others?
Well, that's a complicated question. There's not necessarily one specific pattern, but as we look at it, there is a genetic component to it, right? And then there are a lot of people that don't have any family members that get it. So women tend to be affected more frequently than men, and also people that generally are unhealthy are affected more than people that are healthy.
Dr. Wald, what are the biggest risk factors for someone who could potentially get Alzheimer's disease?
Sure. So the number one risk factor is increasing age. We can't really do anything about that. We're going to keep getting older. The second biggest risk factor, and probably the most important one because it's the one that we can control, is vascular risk. So that means any high blood pressure, high cholesterol, thyroid disease, sleep apnea, anything that puts your heart at risk also puts your brain at risk. So that's really the one that we try to target as people are getting older.
Say you have a loved one, a parent, a grandparent, or someone that you're related to that has Alzheimer's disease. Does that increase your risk of getting the disease?
So it does increase your risk of getting the disease, but there's almost two different categories. So there are a couple of genes that we are aware of that really put a person at a dramatically increased risk of developing Alzheimer's disease. If a person is in that category, typically they'll see that they have other family members that develop Alzheimer's disease, generally at a slightly younger age. Those people are at a significantly higher risk. And then beyond that, for people that don't have that gene, if they have family members that have Alzheimer's disease, it can also increase their risk, but not as dramatically as people who have this gene we call the ApoE4 gene.
People see the word Alzheimer's, they see the word dementia, but sometimes people aren't sure how to differentiate the two. Can you talk to our audience about what is the difference, if at all, between someone who's diagnosed with dementia and then someone who is diagnosed with Alzheimer's?
So dementia is a description of problems with thinking skills. So by definition, a person with dementia has an impairment in their memory and at least one other thinking skill. So it can be their ability to see things in space, their ability to focus on things, their ability to juggle information in their mind and give it back to a person in a different form. So dementia is impairment in memory and one other thinking skill. And there are many, many things that can cause dementia, the most common of which is Alzheimer's disease, which is why we hear about Alzheimer's disease. But there are many things that cause dementia. There's vascular dementia, there's frontotemporal dementia, there's primary progressive aphasia, there's Parkinson's disease dementia, diffuse Lewy body disease, and it goes on and on. But again, the most common one is Alzheimer's disease, so it's the one that we hear the most about.
So what can we do as we know what our potential risk factors are? What can we do to increase our chances of not getting Alzheimer's disease? Are there keys that we can use to make sure we live a healthier life?
A lot of them are the things that your doctor tells you to do every single time you meet with him or her. So that's get exercise, eat healthy, have your regular checkups with your doctor. And if you do have any of these vascular risk factors that we're talking about, like high blood pressure, diabetes is a big one, thyroid disease, sleep apnea, peripheral vascular disease, atrial fibrillation, any of these things that put your heart at risk, you want to be very aggressive in managing them along with your doctor. You want to stay on top of your own cardiovascular health, and that's how you'll keep your brain at health in the same way.
So how important is exercise then, with that being said?
Exercise is crucial. Exercise is really important, not only in order to lessen the risk of developing dementia, but once a person does have dementia, it's really, really important that they keep moving and they keep exercising. Unfortunately, with dementia and with Alzheimer's disease, it's sort of you're either going forward or you're going backward. There really isn't kind of staying stagnant. Once a person has Alzheimer's disease, if they can keep moving and keep moving themselves forward, they give themselves the best chance at a high quality of life.
I'm sure there's going to be people watching this that say, well, Dr. Wald, I forget things sometimes. What is normal forgetfulness with aging compared to somebody who might have symptoms of Alzheimer's?
Right. So the way that I like to explain it is that if a person is 75 years old, they probably can't throw a baseball the same way that they did when they were 30 years old. It's just, your body ages, your muscles don't work the same way. The brain is exactly the same way. You're not gonna be able to remember things the same way you could when you were 30 years old. You're not supposed to be able to remember things the same way you could when you were 30 years old. You're also not gonna be able to come up with words the same way as easily as you were when you were 30. But the real question is, are you aging at a normal pace? Are you having normal aging? Or is your brain aging at a faster pace than we want it to? That's a difficult thing to know. That's why you go to your doctor to figure out, is this happening faster than it should, and what can we do about it?
So what treatments are available to patients who have been diagnosed with Alzheimer's disease that maybe can potentially help them stave it off for at least a period of time?
Yeah. So there are two classes of medications that have been around for a very long time. There's the NMDA antagonist and the acetylcholinesterase inhibitor. These two medications have been around for quite a while. Generally speaking, they will give a person a cognitive boost. The company line is that we'll give you a boost for somewhere between 3 and 6 months. I've seen people get a lot more benefit from it. I've seen people get little or no benefit from it. So those have been around for quite a while. And what's becoming very popular now is the monoclonal antibody. And essentially what the monoclonal antibody does is it treats the abnormal bodies in the brain as if they are invaders, sort of like a virus, and it attacks them and breaks them up so that they don't keep appearing on the brain, and the ones that are there, it kind of destroys them. There are now 2 FDA medications, FDA-approved medications that fall into that category, the monoclonal antibody. The problem is it's very complicated because when you do something like that to the brain, it causes other problems. So if there are some of these abnormal bodies that appear on the brain, plaques and tangles, that a lot of people have probably heard the term, if you break these bodies up, what can happen is sometimes they're attached to blood vessels, sometimes they're attached to arteries. And if you pull that away from the artery, it can cause bleeding into the brain. Sometimes it can cause swelling of the brain. So there's a lot of complications here. It's not just as simple as treating it like a virus and attacking it. So there's a lot of research on the monoclonal antibody going on right now, but there's a lot of safety issues as well. So that's why the research seems like it's moving sort of slowly.
Finally, let's talk a little bit about the Marcus Neuroscience Institute and the care that is provided here for people in the community of South Florida. What can you tell us about what sort of care people can expect if they come here for any sort of memory disorder?
Yeah, I think that what people will find when they come to Marcus Neuroscience, I know when I started working here, one of the things that really struck me was the fact that, yes, the doctors are very, very smart. And I think that hopefully patients come to expect that their doctors are going to be very smart. But one of the things that's really remarkable is that I find that all of the neurologists that work at MNI are just really personable human beings that you feel like you can talk to. Like they're the kinds of people that you feel like actually have real lives outside of the hospital. They're just easy to understand, easy to get along with, which is not always an easy thing to find. So I think it's a wonderful place.
Well, Dr. Wald, thank you so much for taking the time to talk with us today about this very important subject for Alzheimer's Awareness Month. And of course, we would also like to let you know that if you would like more information on the Marcus Neuroscience Institute, be sure to go to the website.